right, well, why don't we get started? Welcome, everyone, and thank you so much for joining us today. My name is Anne, and on behalf of the entire CredibleMind team, I'm really excited to welcome you to Stronger Together, a celebration of our 2025 Mental Wellbeing Award winners. Just a quick agenda, just some brief housekeeping. I'll give a brief overview of the awards for those of you who maybe are new to the CredibleMind family. Or weren't able to submit this year. And then you will hear from our wonderful award winners. We'll briefly talk about some of the Distinguished Achievement winners, and then we'll open things up for some Q&A. Just a bit of housekeeping before we dive in. The session will be recorded. We've been asked that a bunch leading up to this webinar, so we will be sharing the recording with you afterwards. And you can submit questions at any time using the Q&A feature. So we'll try to address as many as we can in real time in the chat, followed by a wrap-up Q&A session at the end of the presentations. If your question is directed at a specific presenter, please note their name or maybe their organization name in your question so we know who to direct the question to. So a bit of an overview of the awards. The purpose of today's webinar is about recognizing and learning from organizations that are moving mental well-being forward in real, tangible ways. So these communities that are not just about talking about mental health, they're normalizing it. They're supporting it and embedding it into everyday life. The CredibleMind Mental Wellbeing Awards were created to celebrate our customers who are doing exceptional work to improve mental health and well-being in their communities. What makes these awards unique, in my opinion, is that they recognize impact across three critical dimensions of well-being: promoting flourishing and well-being by focusing not just on reducing illness, but on helping people thrive across emotional, psychological, physical, and social dimensions; reducing stigma around mental health by creating safe, supportive environments where people feel comfortable seeking help; and empowering action through communication by engaging people with trusted information, sparking curiosity, and encouraging proactive steps toward better mental health and well-being. Each of these categories reflects a different but equally essential way of advancing well-being. They each tell a powerful story of what's possible when organizations take a thoughtful, community-centered approach to mental health. So during today's webinar, this will give you the opportunity to hear directly from this year's winners, organizations that have brought these principles to life. So you'll hear about programs and initiatives designed to reduce stigma and create open conversations, strategies for promoting flourishing, meaning, and resilience, creative communication approaches that engage people and drive real participation. And then lastly, and hopefully practical lessons learned that you can take back to your own work. So with that, it's my pleasure to introduce our 2025 CredibleMind Mental Wellbeing Award winners. This year, we were fortunate enough to receive an incredible number of thoughtful, inspiring submissions from across the country. The quality and impact of the work being done made the selection process especially meaningful and very difficult. I think I can say that all of us really struggled. They were also wonderful, and ultimately led us to recognize not only winners in each category, but also an overall winner whose work stood out across all dimensions of mental well-being. So our 2025 award recipients are Bartholomew County in Indiana, West Central District Health Department in Nebraska, Upper Missouri District Health Unit in North Dakota, and Winnebago Public Health Department in Nebraska. Each of these organizations is doing really meaningful on-the-ground work to strengthen mental well-being in the communities they serve. So with that, let's jump into things. I'm going to pass it off to Julie Orban. Julie, I'll do a quick intro for you. Julie has spent over 36 years in the utility industry working in both customer-facing and internal operation leadership roles, focused on customer research, progress improvement, coalition building, as well as team collaboration. Julie decided that her next journey would allow her to give back to the community that has given so much to her and her family by serving as the project manager for MHM for almost 3 years. She and her husband Chip have grown three grown children, twin daughters Corinne, who's a nurse, Kristen, who's in her second year of law school at Creighton University School of Law, and their eldest son, Devin, who is a budget manager for Children's National Hospital in Washington, D.C. Julie, take it away.
Thank you, and congratulations to the other award winners. I apologize if some people are like, well, where's Bartholomew County in Columbus, Indiana? We're about 45 minutes north from Bloomington, Indiana, which is the home of the National Championship Indiana Hoosiers. So I had the fortunate experience to travel with them through that journey. So my voice has been weakened by the cheering and then catching a cold, so I apologize for that. So you can see about the history of Columbus Regional Health and the area which we serve. So every 3 years, Columbus Regional Health does a community health needs assessment, and from that assessment, we look at community initiatives. And when I say community, our network within the community steps up to say, we will give time, talent, and resources as we embark upon this journey together. So, literally 3 years ago, February 10th, we kicked off Mental Health Matters. During that period of time, we looked at state, local, and national data, and then also did our own research in focus groups, one-on-one, in surveys to develop kind of a baseline of where are we going to go next. And from that, we developed 5 elements of mental well-being, which are system access, which can people get access to mental health services? Provider pipeline. Do I have someone that looks like me, understands me, bilingual, things of that nature? Programs, services, basic needs. If my basic needs aren't met, I can't take care of my mental well-being. And then knowledge and perception. If you want to go to the next slide, Anne, please. So from there, we looked at what was our mission from the very beginning, which, as I said previously, it was a community-wide initiative to improve the mental health for both youth and adults. Our resource team was the team that gave the money, time, talent, and resource. And then the guiding team were those individuals that we talked to throughout the community as we walk through this journey together. So if you want to go to the next slide. As we started this work, we looked at the focus of a specific initiative that we had that we've never done in any of our initiatives in the past. We developed a team of what we called ambassadors, and those individuals in the top right were individuals that volunteered their personal time to walk with us on our journey to represent what we referred to as micro communities. So they were seen as someone that could be a liaison as we talked about what programs, how we would communicate, how we would start the story of, you will, of talking about mental health and communicating programs and services. So these brave individuals stood up and said, you can use my story. Simultaneously, we were kicking off CredibleMind, which we kicked off in May 1st of 2024 to the community, and also launched the Standing Up Against Stigma campaign. If you will notice in the cards in the bottom right, there are QR codes that are on these cards. So the content within their stories goes back to information within CredibleMind. So that gives us the opportunity to continue to tell a story, reference programs and services, and continue to reinforce the conversation across all genres, if you will, and then also give them information to basic needs and also provide them access to providers. That's the beauty of community resources. tab with Incredible Mind. When we talk to our providers and partners within the community, they never have a time to come together and really share information. So that's something else unique that we did during this journey is we gathered all of them together on a quarterly basis to talk about content, information, share, education, and they helped as to disseminate this information to their clients, to their teams. And we look at providers and partners in two different groups. We have what we call big P's and little P's. Our big P's are those that are licensed individuals. Our little P's are those individuals that are asked to step up and talk to people that are struggling with mental health challenges. Our teachers, our primary care physicians, nurses, police officers, so on and so forth. So it's an avenue to bring them all together to have an opportunity to discuss, be aware of resources, have education, and to also promote the website as well. Pardon me, Credible Mind as well. We have had resounding success to the Standing Up Stigma campaign. Those actually are 6 foot tall banners that are collapsible that we share within the community. These are cards. We've done digital displays, and people come to us and ask to borrow, and then we take these out into community events. To speak to the ambassador team, I don't want you to think that we just brought a bunch of people together and said, hey, go share this information. We had a very guided process that we went through, and we actually developed a guidebook for our ambassadors that if anyone has questions later or wants to contact me, I would talk to you about it. But we started off with training and mental health first aid training. We did ACEs training, developmental relationships training, and then we took field trips. We took them around to different resources in the community. So if someone came to Julie or to Ann and said, I need help, that they knew where to go or who to ask to get that information, because we all know we typically have mostly one chance when that someone says, I want help. And so we wanted to make sure that they were that resource and that they were prepared. We have a GroupMe app that we use with them to communicate. So if there's new information out there, so they really have been a central part, central focus of this entire journey as we move forward. And if you want to go to the next slide. So this is what we feel like have been our keys to success as we've gone through this. So our ambassadors have helped us on information of, clarity, inclusivity, so that our ambassadors, that was just a few of them, are across all different communities, gender, age, we just made sure that we were trying to get to all our different micro communities, and gave them a chance to tell their stories. And that was the beauty of it, because those were individuals that lived, worked, and played in our community that were sharing their stories. And literally, you'd have people come up and say, I didn't know that. And I gave them hope, which was what we wanted to do. We promote the Standing Up Stigma campaign on our website, newsletters, and then traditional media outlets with collaboration with our Alliance for Substance Abuse Progress. They've been very supportive and actually paid for the campaign for us. And so we promote that because we know there can be a co-occurrence with mental health issues and substance misuse. Our schools, employers, all of the institutions have reached out and hosted activities where we could come in and promote Credible Mind and also promote and have conversations as well. Again, I truly believe that our ambassador network was unique and really what helped us to open the conversation. Just a little quick aside, we decided to have a community book read, and we just kicked it off this month about I'm Not Sick, I Don't Need Help with Dr. Amador, which is kind of a heavy read and a serious topic with serious mental illness. And we didn't know how it would be perceived. Our kickoff, we had 40 people on a Friday morning. we were amazed. But we've had judges and faith leaders step up and agree to facilitate that discussion, and we believe that has helped as well to get people there. And then our community events. I can't name all the different community events that we attended, from Pride to the summer kickoff event to close school, kickoff to open school. So we tried to look at different content to promote within those. We developed a lot of different cards that would send individuals to Credible Mind. So, quick story, we developed a card about grief. And because in Bartholomew County, if someone passes away, the death certificate is picked up at the health department. So we developed really targeted information as well so that we could get a variety of different target markets and that information out because I still hear today, what's Credible Mind? I didn't know it was there. And it's an amazing resource. And so we keep pointing back to that as much as we can. So it's hard to tell our entire story very succinctly, but I'm happy to have anyone reach out to me later. And thank you for the opportunity to share.
Thank you so much, Julie. All right. Well, now I would like to introduce Trudy Merritt from West Central District Health Department in Nebraska. Trudy serves as the Social Impact Coordinator for West Central District Health Department and has been with the department since 2020, bringing a lifelong commitment to whole person health and well-being to everything she does. With more than 30 years of experience promoting healthy lifestyles, she understands that physical health, mental health, and connection are deeply intertwined, and that supporting one strengthens them all. In her role, Trudy leads and manages the Working Well program, an employee wellness initiative that supports both our internal team and local employers. Through this work, she helps create healthier, more resilient workplaces by centering wellness as a shared responsibility rather than an individual burden. Trudy does not just teach these values, she lives them. Her work reflects a deep belief in the interconnectedness of people and communities. Echoing Dr. Martin Luther King Jr.'s words, we are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. Her passion, authenticity, and unwavering dedication make her an integral part of their department and a trusted leader in advancing well-being for all. So Trudy, I'll pass it to you.
Thank you. Thank you. All right, a little bit about West Central District Health Department. We are located in West Central Nebraska. If you don't know much about the state of Nebraska, nearly the entire population of our state lives in the eastern part of the state within about 100 miles from the border. So we are the very definition of a rural community. The population centers definitely are Lincoln and Omaha, and we are responsible for a 6-county region, and some of our counties are some of the least populated counties in the entire country, definitely in the state of Nebraska. The rural lifestyle is a wonderful lifestyle, but it also creates a population of folks. North Platte is our home city. It's about 23,000 or so. Our jurisdiction has a little over 30,000 in it. But in that sort of rural mindset, sometimes there's starting a conversation about mental health is really difficult. So really what we have tried to do to promote flourishing is to allow people to see that they are a whole person, that health means both physical health and mental health. And in order to flourish, both are required. Next slide. So as that introduction said, there is a core value that I possess. And I think that it is woven into public health as a whole. Another take on that is none are well until all are well. That's from Father Gregory Boyle. West Central District Health Department does believe that the flourishing of one is tied to the flourishing of all. And that actually We use art and science in public health to synthesize physical and mental well-being to serve the whole human. Sometimes there's not only misperceptions about what it means to live in a rural state and a rural area in a rural state, but also what really is the work of public health. And it is not a singular thing, it is multifaceted, it is multi-layered, and it does cross the whole of human experience. Next slide. So we believe here at West Central that in order to promote flourishing, we really need to start at home. So we promote flourishing and well-being by first taking care of the team that is charged with delivering public health services to our communities. All employees that work here have access to employee assistance for mental health services. I think the really remarkable thing, especially in the current insurance climate, is that all eligible employees are eligible for health insurance at no cost to the employee. So we pay no premium for health care, and that health care includes behavioral health services. I think most importantly, the way we promote flourishing at home starts with our leaders. We have leaders who foster a culture of incredible flexibility. They promote and provide us balance. There's consideration and a sense of community that lives alongside our mission to care for those in our community. So it's our leadership that fundamentally cares for us, which then allows us to go out into the community and care for others. West Central District Health Department does provide a workplace wellness program, and we have 100% participation among all our eligible staff. Next slide. Credible Minds is playing a key and ongoing role in the work that we do. It is embedded on our website. It is offered free of charge to residents in our 6-county jurisdiction. That's important because, again, in a rural setting, especially in really rural counties, it can be sometimes, it feels like there's a stigma attached to trying to learn anything about mental health. But Credible Minds on our website and free access to it is probably the most inviting, least threatening way that people can actually just begin to explore the idea and all of the topics available on Credible Minds, and explore the idea that mental health is health. So we do offer support and education to our communities through the integration of Credible Minds into our public health practices. Again, it's free on our website. We have enjoyed a robust response because I think people, again, it's a safe way. Nobody has to know that you are looking at Credible Mind resources. So it's a safe way for people, even maybe, to start the conversation with themselves about mental health concerns that they might have. And we have enjoyed a really robust increase in its use from our website, including that within our wellness program. So at the time of our award application, new registered users had gone up by 33.33%. Topic center use was up 5.2%. Those who read an insight up 358%. I think that number reflects people craving information and reliable information. They know when they come to West Central's website and use that resource, Credible Mind, that they are getting reliable information. Those who used a resource actually used it in a practical way was up 272.8%. Those who watched or listened to a resource up a remarkable 1,245.3%, and those who read a resource was up 235.8%. Next slide. We did, as you heard in the introduction, create a workplace wellness program that is perhaps almost countercultural. It's almost a little bit subversive in that it relies very little on technology and relies on that person-centered, person-to-person comprehensive approach. Credible Mind is actually embedded into the program requirements. So county employees, we service all of the employees of Lincoln County here in Nebraska. The health department employees and then local businesses are included. The really fun thing for me as the administrator of that program is to see the way that participants, once they take an initial assessment in Credible Mind, the way that criteria just expands as they seek and crave the information available to them through Credible Minds. So they are required to take one assessment per quarter, just one. And almost all of our active participants take 5, 6, 7, 8, 9, 10. Some of them, I think, at this point in their program have completed every assessment available to them. And I think that's a testament, one, to the sound nature of the information available on Credible Mind, but also people's just need and desire and craving, again, for information in the least threatening way possible, that where they don't have to feel self-conscious and exposed. The Credible Mind resources complement the lifestyle and physical activity components of the program. We sure do address their physical health. That's a big part of it. But again, for the first time, and again, I think one of the things that I'm proud of is that for a lot of our participants, this is the first time, including their healthcare providers, where they've been told the two go together. They are not singular and separate, but our mental health affects our physical health, and our physical health affects our mental health. So we cannot silo those two things as though we could separate ourselves. If we want whole human health, we have to help people understand how those two things integrate together. Next slide. So we do offer a couple of community programs that we just made sure were woven with and layered with this idea of mental health, of personal empowerment, resilience, tenacity, grit, all of those kinds of qualities. And of course, when you want to foster those qualities, where is the best place to begin? It's with our kids. So we offer a public health program. I can't take credit for the program. That belongs to the University of Texas School of Public Health. But we offer their program modified to suit our community called Marathon Kids. We're really blessed to be able to offer that program inside of our North Platte Public School District's after school program. And that serves all 7 of our public elementary schools. And Marathon Kids is the ideal platform to start teaching kids young, so we don't have to reteach them as adults, that mental health and physical health go side by side, are side by side. In addition to the importance of physical activity for their physical health, we also relate things like mood, feelings, and how exercise affects those things and affects just their general experience of life. Each school year, we are able to impact over 300 students, and we are in our 5th year with our Marathon Kids program. Next slide. So the motto, the core belief that I think is essential in today's world to teach our kids is that every one of those children that you see and all children are able to do hard things. I spent 30 years supervising teens and have watched how dramatically their sensibility, their resiliency, their ability to withstand adversity has gradually declined. And so starting at the other end of the age scale with elementary students. I felt like it was really essential that that be the core belief and the core message, because our kids were sort of suffering from a shortage of resiliency. And so that's core to what Marathon Kids is all about. Next slide. We have a couple of other large community events that we use to promote the whole message of flourishing. We are home to a really unique public health initiative. It's actually in its 25th year this year. 5 of those years spent here at West Central District Health Department as its home base. And at its core, this initiative has at its foundation human flourishing. It's in its mission statement, it's in its values, and in its core purposes. We provide, technically, you could call them races, because they are, but we oftentimes refer to them as fitness events. They are offered community-wide all across the region. We make sure that cost is not a barrier, so that's the lowest entry fee possible. We might call them races, as I said, but they are actually events open to all ages and abilities. So we have participants receiving that message of flourishing from ages 3 to 83 and above. Every year, this initiative hosts 18 separate events, but for this conversation, 2 of them are specifically focused on mental health. Next slide. The first one that I'd like to talk about, well, both of them in general promote physical activity, and they serve as a medium for public awareness and conversation, not only about mental health, but also about suicide prevention. We've been blessed by the willingness of a local family to share their suicide story with us, and that story has literally created a movement across the country. The Tyler Vander Heiden Memorial Run is held in May every year. It will be in its 6th year this year, and its sole purpose is to help reduce stigma nationwide about mental health concerns and suicide prevention. We have enjoyed, because the belief is that mental health concerns touch everyone across all boundaries and all borders. It doesn't matter what side of the tracks you live on, what your income is, what the color of your skin is, how you identify. None of that matters, in the sense that for every human, mental health matters. And so we want to spread that message with this event. And so we feel like we are accomplishing that mission, because for the entirety of this race, we have had either in-person or virtual participants from all 50 states in the US. And I might remind you, that's a huge accomplishment when you live in flyover country, and sometimes people have to ask you where Nebraska's at. We'll just go in the middle, because we're right in the middle. So that is truly a statement, I think, about how much the idea that our flourishing is dependent on good mental health speaks to people. We reach all 93 counties in Nebraska. And again, your neighborhood where you live might have more people in it than some of these counties, but we will get at least one person from all 93 counties in Nebraska. And then we've had 5 separate foreign countries represented as well. The mission of this race is twofold. It's to raise awareness about mental health concerns and about suicide prevention. But it also is designed to remind people the value of physical activity in improving their mental health, and the value of nature in their mental health. And so over the course of this race, we've been able to contribute over $40,000 to trail improvement within our state park system, with the intention that there is health and healing in nature. Next slide. The second event that we have is that is mental health focused is a particularly touching one. I can't make it through the race day without several episodes of weeping, because it is an incredible blend of trauma and PTSD and struggle and victory. So our Heroes March Ruck and Run is hosted by our local American Legion and is directed by veterans who served our country in Iraq and Afghanistan. Both of our race directors have experienced their own PTSD, as well as the loss of their brothers from suicide. So this event centers on PTSD awareness and veteran suicide. It also, however, especially as the after effects, if you will, of the pandemic on healthcare workers became more visible, it also is designed to shine a light on PTSD in healthcare workers and the community at large. To reward our winning athletes, challenge coins, which if you know anything about military culture, they are considered sacred. They are presented to winning athletes and they are emblazed with the message, be the one. And what that means is be the one to help someone find the support and resources that they need, because when we share struggle, we can all find flourishing together. This event has grown in each of its 3 consecutive years, and its ultimate goal is to remind people that no one should ever struggle alone. Next slide. We believe deeply. We are a small health department in a rural area. There are, I believe, 8 employees full-time, 4 that are part-time. We live in a very small town, blue collar, under the average income for our state, and Nebraska is probably under the average income for the nation. So we are coming from a very humble place. But what we are not humble about is our desire to promote flourishing and consider that our mission. It is a difficult moment in time for many, including those of us here in public health. Resources are diminished, our staff has been reduced, and yet West Central District Health Department continues to be committed to fostering health, well-being, and flourishing through the whole, full human experience, even in our present reality. We are staying committed to the idea that mental health matters into the fuller picture of well-being. So we've created what we think is innovative programming to address whole human health that model to our community that we will stay the course and that we are committed to well communities. We persevere in our mission, and the mission here at West Central District Health Department is to educate, promote, and improve the overall health of our communities and each resident, allowing all who live, work, and play within to thrive. And when one thrives, we all thrive. Thank you.
Sorry, I couldn't find the mute button. Thank you so much, Trudy. I'd like to introduce our next speaker, Daphne Johnson-Clark from Upper Missouri District Health Unit. Daphne Johnson-Clark is the protection team leader for the Upper Missouri District Health Unit. She's worked there since 2003, fulfilling several roles over her years, including general environmental health, emergency environmental health, and public information officer. In her off time, Daphne paints and sculpts, completing a master's degree in fine art painting from the Academy of Art University in 2019. She became certified to teach thinking art from the National Gallery of Art in 2023. She lives west of Williston with her husband on their growing alpaca ranch. Daphne, I did not know that. DRC Windy Acres, and enjoys time spent with her 2 grown children.
Thank you.
Daphne.
So Upper Missouri District Health Unit is a small rural and frontier four-county health unit in the northwest corner of North Dakota. Um, and so we have been working on ways to get our message out in more kind of new and innovative ways. And one of those ways is looking at the arts to solve public health issues in our area. And so we partnered with a local artist to use this piece of artwork in our promotions of CredibleMind. And one of the reasons that this piece of artwork was chosen was because the artist created this piece kind of to address some of her issues with seasonal depression. And I know there's been lots of bad weather going on across the nation in the last couple of weeks, but we end up with a lot of seasonal depression. Last week we had minus 30 degrees regular temp, and then with the wind chill it was minus 50 degrees. So there is issues when you can't go outside and get some sunlight when it's that cold. And so our goal is to create better messaging for public health by using the arts and community engagement to do that. Next slide. So we started with our own grassroots little ads that we put together for social media. And so this is kind of the stickers we made and our social media and some business cards that we made to hand out. Next slide. And so then we did what we do. Several on here are public health, so you understand how we partner with our community partners to get our messages out. And so a lot of them that we usually work with are schools and our college. Those are pretty normal. But we also then partnered with veterinary offices and funeral homes to get out our information and then specific links to the pieces on CredibleMind that deal with loss and things like that. So then we also, with the airport, that was a new partnership. We ran an ad there for several months, and it was in the area where you depart. As you know, if you're in rural areas, you sometimes have late departures. Planes don't leave on time. So it was kind of nice to have that QR code right there in those areas where people were stuck and maybe had time on their phones. And then coffee shops and things like that, where we knew that the younger people were going, having stickers right on those coffee cups. So we thought that by embedding that campaign in our everyday environments, that we could increase our visibility and accessibility to the people that we serve, kind of meeting them where they're at and trying to get more traction. Next slide. And then we were lucky enough to receive some grant funding. So then we could do some paid advertising. And the picture here is of one of our billboards, which was one of our most popular pieces from that advertising. And we were lucky to work with an advertising company who was willing to work with what we had already been doing. So they built upon that, incorporating that piece of artwork and kind of coming with the, bringing the color back theme of using CredibleMind to do that. And this is the billboard that had the best response. So next slide. And then this is where, if you can play the video, Anne.
Is life? Can everyone hear that? Okay, the sound?
Mm-hmm.
Okay. Does life feel drained of color? The things you normally care about have turned gray. There are things you can do to help yourself turn it around. CredibleMind has resources to help you take back control of your outlook on life. If you need crisis support now, please immediately call 988. Otherwise, visit umdhu.crediblemind.com to help bring the color back.
So that was the video piece that we were able to have them put together for us. Once again, we're very lucky that they still incorporated the thoughts that we had with that, bringing the color back and using that piece of artwork. And that was some of the stuff that we had like the best feedback from. So, as you can see, we did see by the numbers, we saw an increase in our users going to CredibleMind. We also then did specific promotions at the college and then surveyed the college students there. So that's where we got our numbers there with asking them specifically, like, did you connect with the art piece? Like, did you feel like that was something you would connect to rather than using something that was maybe a landscape or something figurative? Like, specifically, did the abstract piece of art reflect to them? And we got that 67% said yes, that piece connected better. And then we wanted to find out if they found useful things on CredibleMind. And 100% of them said that they found helpful resources on CredibleMind, which I thought was a good feedback coming from college students. Besides the quantitative pieces, we also did some qualitative. And collecting some stories. For instance, our artist talked about her seasonal depression and reflecting on that piece of artwork, but also getting some of those qualitative statements from the students about how they connected with the black and white to the color coming back. And we thought that that was important for the storytelling part also. Next slide. And then one of the things that we found is because we used a local artist, we were able to have her do promotions for us. So she did a radio interview, and we could watch the numbers go up after those things would go out. And so that brought us more authenticity, I think, in our advertising and sparking more trust because we had somebody who was a trusted member of the community telling her story and we were kind of on the sidelines. And so she was able to carry that water for us. Um, I think that might be all for my slides. Thank you.
Thank you so much, Daphne. Well, we're a little short on time here. I'm just going to quickly go into our last, but not least, speaker of this webinar today. Unfortunately, the Winnebago Public Health Department couldn't be here with us today, but they did put together a brief recording of the work that they are doing to reduce stigma in their community. So I will pull that up in a minute, but I will introduce the speaker that is presenting. Mona Zavante is a member of the Seneca Cayuga Nation of Oklahoma. She has been the Chief Public Health Officer for the past 13 years. She received her MPH from Concordia University in 2017 and her PhD in Indigenous Health from University of North Dakota in 2023. She currently oversees the 2022 field health programs within the Winnebago community. She has had the privilege of serving on several national boards such as NACCHO, NPHF, and regional boards such as Buffett Cancer Advisory Board and the Great Plains Tribal Advisory Board, and many others. She's had the honor of receiving the UNMC Distinguished Researcher in 2023. The most important role that she has had is being mother to four amazing children she enjoys in her spare time to bead and sew. Her parents have set the foundational road that led her throughout her life, and she is so blessed to be able to do all of this work. I will pull up her recording. Uh-oh.
Wira rochanje haikapi, hanach hine karagi wina, hochunk rajra, uwa, nuk, winga, wa uenjena, makre rajra, monozavanti, wa uenjena. Good afternoon, I greet all of you a good day. My Ho-Chunk name is Little Elk, my English name is Mona Zavanti. I'm an enrolled member of the Seneca Cayuga Nation of Oklahoma, and I proudly serve the Winnebago Tribe in Nebraska as their Chief Public Health Officer for the Manka Chinook Wogijide Ra, which is the Winnebago Public Health Department. Pinagigi thank you for allowing me the honor to speak with you today. I apologize for not being in person, but I'm going to share with all of you some of the ways we are trying to destigmatize mental health in our community through culture and care. When we talk about mental health in Indigenous communities, we must begin by remembering who we are. Long before clinical languages, diagnostic codes, or service systems existed, our people understood wellness as balance. Balance between mind, body, spirit, family, land, and community. Mental well being was never meant to be carried alone, it was shared, supported, and held collectively. Yet over time, colonization, historical trauma, and systems not designed for our people disrupted those ways. Silence replaced conversations, shame replaced support, and too often, mental health became something to hide rather than something to heal together. Today, I want to speak about how we are reclaiming our Indigenous ways to destigmatize mental health in our community through advocacy, visibility, access to care, and most importantly, relationships. At the heart of this work is Kikijide, our community crisis response team. Kikijide is more than a program, it is a promise. A promise that one of our relatives is struggling, they are not alone. A promise that help is available without judgment, without punishment, and without fear. Through Kikijide, our relatives can call and speak to someone who understands our communities, our families, and our realities. They can create a safety plan rooted in compassion and dignity. This approach reframes crisis not as a failure, but as a moment where support is needed. By making it safe to ask for help, Kikijide directly challenges stigma and replaces it with trust. Stigma thrives in silence. Kikijide disrupts that silence by showing up day and night and by meeting people where they are, both physically and emotionally. We have also worked intentionally to bring mental health into the open through community-centered events. Our mental health awareness, health fairs, and suicide awareness walks are powerful examples of advocacy through presence. When families walk together, when elders, youth, staff, and leadership stand side by side, we send a clear message. Mental health belongs in the community, not hidden behind closed doors. These events normalize the conversation. They turn awareness into action, and they remind us that prevention is not just clinical, it is cultural, relational, and visible. Our behavioral health outreach team has also been essential in reducing stigma, particularly among our youth. We know that our teens are navigating complex pressures, identity, social media, historical trauma, and modern stressors all at once. Instead of expecting them to engage through traditional clinical modes alone, we are meeting them creatively and respectfully. Through journaling campaigns, vision boards, and expressive activities, we are giving young people tools to tell their stories, imagine their futures, and process their emotion in ways that feel safe and empowering. These activities do not label or bring further stigma. Instead, they honor self-expression and resilience. They remind our youth that their feelings matter and that seeking support is strength, not weakness. Another important part of our stigma reduction strategy is access to trustworthy, culturally respectful resources. We are using CredibleMind and sharing it through our Facebook page as a tool our relatives can access privately at their own pace. This matters because not everyone is ready to walk into our office or raise their hand publicly. Sometimes the first step towards healing happens quietly in the safety of one's own space. By offering this resource, we acknowledge different readiness levels while still reinforcing the message that mental health well-being is a priority and support is always available. Reducing stigma also requires addressing systematic barriers, which is why access to care is a core focus of our tribal community health improvement plan. This plan is not something created in isolation. It is grounded in community, voice, data, and lived experience. It identifies gaps, sets priorities, and holds us accountable to continuous improvement. As part of this effort, we are expanding access by increasing the number of therapists available to our community and offering after-hour services through both our behavioral health and Kikijide teams. Mental health crises do not operate on business hours, and neither should care. By extending availability, we reduce barriers and reinforce that help that is there when it is needed most. Coordination is also key. We are strengthening our partnerships with 12 Clans Unity Hospital that holds our primary care to increase behavioral health presence and integration. This coordination reduces stigma by normalizing mental health as part of overall health. When behavioral health is visible in these settings, it sends a powerful message. Mental health well-being is healthcare. This integrated approach also ensures that our relatives do not fall through the cracks. It creates continuity, shared responsibility, and a more holistic system of care. At its core, destigmatizing mental health in Indigenous communities is about returning to our teachings. It's about remembering that we heal in circles, not in isolation, that asking for help is an act of courage, and that wellness is a collective responsibility. This is seen through the powwows, the arts, the crafts that we continue to bring about in our community and share with one another. Our work through Kikiji Day outreach, community events, youth engagement, access planning, and coordinated care is not about importing solutions. It is about restoring balance, using both Indigenous wisdom and modern tools guided by community voice. We still have work to do, but every conversation started, every safety plan created, every youth empowered, every barrier reduced brings us closer to a community where mental health is spoken openly, supported fully, and held with care. Thank you all for standing with us in this work. Thank you for honoring our relatives by listening, learning, and acting. And thank you for helping us to reclaim our Indigenous ways of caring for one another, mind, body, spirit, and community. I am privileged to be among one of these noteworthy honoraries. And Pinigigi, which means thank you, and Ho-Chunk, to all of you for listening and being able to share my story, share our story from the Winnebago Public Health Department.
Great. Well, before we close, I just wanted to take a minute. Let me go back into slideshow mode here. To recognize the recipients of our Distinguished Achievement Awards. So these organizations are doing outstanding work to support mental well-being in their communities and amongst their users. And their submissions really truly stood out to us. We're proud to recognize their impact and really grateful for the work that they continue to do. So you can, read the organizations that received those awards. I think in the interest of time, we've got about 2 minutes. I do want to just close out and thank everyone. I think if there are any questions that came through, we can send those over to any of the presenters that received any questions. But I do really want to thank each of our award winners for sharing your work, your amazing insights, and your experiences with us today. I think the programs and initiatives you described are really powerful reminders that meaningful change happens when mental health is approached with intention, with creativity, and compassion. So I really feel like each of you is demonstrating what's possible when this work is really embedded into the fabric of our communities. And to everyone who joined us today, thank you so, so much for being a part of this community and for the work that you're also doing to support mental well-being where you live. Really hope that these stories you heard today kind of spark new ideas, reinforce what's working, and remind you that you are not alone in this effort. So congratulations again to our winners, and thank you so much for joining us.